morning. I am Dr. Jayakumar Subbiah. I am a specialist orthopedic surgeon currently working in Abeer Medical Center, Hamour. I am basically from India, and today I am going to talk with you about low back pain, which is one of the commonest complaints the patients come to us in the outpatient department. Low back pain is very common because it occurs in at least more than 80% of the patients at least once in their lifetime. So they usually have this back pain at least once in their lifetime. It is that common, and the major risk factors, the patients who have these risk factors are prone for low back pain. Number one is obesity, smoking, then patients of old age, female patients, patients with strenuous work in their job pattern, mental health issues, job dissatisfaction, and any stress related issues in the jobs or in their social environment. This low back pain can be categorized as acute back pain, subacute back pain, and chronic back pain. Acute back pain is nothing but if you have a back pain for a period of 4 weeks, then it's called acute. If it lasts from 4 weeks to 12 weeks, it's called as subacute, and if it is more than 12 weeks, it's called as chronic back pain. So the common causes that we come across are usually 85% of the patients will have a non-specific back pain. That means there is no specific cause for the back pain. It usually occurs or appears suddenly when they work in an environment of their day-to-day jobs or when they are getting up from their sleep. So there is no definite cause for this back pain, and these patients are categorized as patients with non-specific cause. The next one is the commonly occurring occupational related back pain. These patients experience their back pain when they have a job which involves prolonged standing, prolonged sitting, or driving for a long time, or any other lifting, that is lifting weights in their job, frequent lifting of weights, and excessive lifting of weights. So all these pattern of occupational work will cause a back pain. The other ones are less serious potential causes. That is, due to the normal aging process, there might be back pain. It could be either due to a degenerative disc or a disc herniation or a disc bulge. It can also occur in when you have a facet arthropathy. That means there is degeneration of the bones of the vertebra. So this also can cause back pain. Apart from that, there is also a condition called spondylolisthesis, wherein due to the aging process, one of the vertebra slips in front of the other vertebra and causes compression of the nerves, causing back pain. Now we will see about how these patients with back pain present to us. Usually the patients will have a pain in their back, and sometimes this pain might be radiating down to their legs, that is the anterior or posterior aspect of your thighs or the legs and up to the foot. When this pain is coming down to your thighs or the legs, it's called as radiating pain. This is because the nerves are being compressed at the lumbar spine level, that is the lower spine level. When your spine, there is a pathology in the spine which causes the compression of the nerves. These nerves come down your thighs and the legs. So there is a pain which is radiating down to your legs. The other commonly used term is sciatica, which is nothing but the compression or irritation of the sciatic nerve. This nerve is formed by the fusion of the nerves in the lumbar and sacral spine. So when this nerve is irritated, either because of a disc or some other chemical reaction happening inside due to the pathology, there might be a radiating pain down to your legs. This is called as sciatica. And certain patients develop pain when they walk for a short distance. And after some time, they will have to sit, bend forwards, and their pain gets reduced. And again they start walking. This is called as neurogenic claudication. So with the patient's symptomatology and after examining them, we will be able to find out a reasonable cause of their back pain. Now coming to the management aspect. So Managing these patients can be categorized as managing the patients presenting with acute pain and managing the patients with chronic pain. The patients who present with acute pain, the most important aspect of management is self-care. That is, you have to remain active even if you have a back pain. Do your day-to-day daily activities, avoid strenuous activities, sports activities, but be active. Gentle stretching exercises definitely helps, but not strenuous exercise patterns or going to the gym. The next one is, if you have severe pain, you will have to consult a physician, and at home you can lie down on your back, keep a pillow below your knees and your head so that you don't strain your spine. This will relax the spine. And while sleeping, you will have to lie on your sides so that your head is supported well and your knee on the upper knee is flexed and there is a pillow between your legs. This will also relax your spinal muscles and will help in relieving the acute episode of pain. Always follow the day-to-day activities even if you have back pain, and always take rest only for a day or two. Prolonged bed rest is not at all required when you have back pain. Remaining active is the secret behind the management of such episodes. Next is massage. Some massage therapy usually gives a temporary relief, and some analgesic medication in the form of gels or ointments also helps. And heat therapy also helps in an acute episode. The next form of therapy are the physiotherapies like exercises, interferential therapy, shortwave diathermy, TENS therapies. But the only thing is, these therapies do not help you in an acute episode of back pain. They are always useful in a chronic back pain patients. Other forms of therapy like spinal manipulation, acupuncture are also available, but these therapies don't have consistent scientific evidence to prove that they have a role in the acute episode. But some patients find relief when they have a chronic back pain. Now coming to the management of chronic patients, that is, the patients who have the back pain for more than 12 weeks. These patients can be managed starting from yourself. So first, self-care is very important. Remain active, do your daily day-to-day activities, avoid strenuous activities at work, take a rest for 1 or 2 but not more than 2 days, and continue your day-to-day activities like your job activities. So now we'll come to the preventive aspects of back pain. That is, how do you prevent low back pain? Just by following these simple 10 steps, it will be easier for you to maintain a healthy spine. So number 1 is, take movement breaks. That is, if you have a job which involves prolonged standing or prolonged sitting, take a 5 to 10 minutes break and change your positions. That is, if you are standing for a long time, rest for 5 to 10 minutes for every 1 hour. And if you are sitting for a long time, similarly take a break and stretch your muscles. Number 2 is maintain posture. That is, avoid slouching in your chairs or slouching while standing in a line. This will cause undue pressure or strain in your lower back muscles. So avoid slouching and maintain your posture. Number 3 is practice proper lifting of weights. That is, when you lift weights, see to it that you lift the weight with your knees flexed, spine straight, and the weight close to your body. This will help in maintaining a proper spine posture. Number 4 is stretch regularly. Always do some stretching exercises regularly so that you keep your back muscles supple and active and in tone. Number 5 is stay hydrated. As long as you take a minimum of 8 glasses of water a day, your spine, your disc and the muscles will always be active and hydrated adequately, because the intervertebral disc we see between the vertebra has 80% of water content. So if it is dehydrated, there are bound to have symptoms because of this and you will develop back pain. Number 6 is practice or strengthen your core muscles. You can consult a physiotherapist or an occupational therapist who can help you with programming a particular set of core strengthening exercises according to your needs. Number 7 is avoid tech neck. What is tech neck? That is nothing but your continued bending your spine while seeing your mobiles or your tabs, which causes at least 60 pounds of additional pressure on your spine. This will cause undue back pain and strain in your low back muscles. So always keep your devices parallel to your eyes and avoid bending for a long period. Number 8 is you should have 8 hours of minimum sleep, because it is at this sleep time that the spine goes into a repair mode. So what are all the activities that has caused strain to your spine in the day will always recover, be repaired at the night time. So maintain 8 hours of sleep time. Number 9 is wear proper footwear. Wearing high heels or an improper fitting tight shoes always causes strain in your legs and ultimately to your spine, because wearing high heels shifts the center of gravity of your body in the forward direction, and this will cause spasm and strain of your low back muscles. And the last but not the least, the 10th one is stress management. Stress in a patient usually causes tension of your neck muscles, shoulder and your low back muscles. So practice stress management strategies like cognitive behavior therapy, meditation and yoga. So all these techniques definitely helps you in having a healthy spine. So as long as you have a healthy spine, you will have a healthy and happier body and mind. Thank you.